I'm Dr. Mehmood, but I'm the consultant interventional cardiologist at King's College Hospital in Dubai Hills. A lot of people ask us, how do we know if they have a healthy heart? Or is it possible to have unhealthy heart in a healthy person? If you don't have any symptoms, you would like to assume that you have a normal heart. However, a lot of times this is not true. How do we decide what is the best test for that? And if you ask a common person, they would answer an exercise test. Most people consider they have a healthy heart if they have done an exercise test in another hospital where they have monitored their ECG whilst they were walking. That's true. However, the accuracy of the exercise test is only 71%. The best test, however, is a CT scan of your heart. It takes only 10 to 15 minutes and it tells you exactly the state of your coronary arteries. It is a kind of angiogram, but it's a non-invasive one. So in this procedure, you come in the morning, you have a cannula inserted in your arm. They would do a dry CT scan of your chest to look at your lungs and your heart and see if there's any calcium buildup in it. And then they might give you a contrast by an injection through that cannula. Then they will take pictures of your heart, of your arteries. Those pictures, 98% of the time, are clearly indicative of any disease or not. So the best test, contrary to our beliefs, is not the exercise test. It's the CT scan. Now, I very strongly recommend people who are diabetic, people who have a family history of heart trouble, and the people who have a history of intense exercise, such as athletes, that they must do a CT scan instead of exercise test. Because in these people, the risk of false positive or false negative test is very high. In women, for example, there's about 40% chance of having a false positive test. So that means you could have a perfectly normal heart, and yet if you run on a treadmill machine, there's about 40% chance that there might be abnormal ECG. It doesn't necessarily mean that you have an abnormal heart. It only means it's not the right test for you. Whilst the CT scan would offer you some x-rays, but it's not dangerous. There's some contrast involved, but it's not dangerous. It is the best test if you want to find out if you have a blocked artery without assuming through an exercise test.